I had two. My first was actually July 7th of 2011, 7/11, and I got the cards to prove it, see? I got an identification card for each eye, and they're serialized, and without glasses I can read the small print, and the second one was done exactly 7 days later on 7/18/11. That was when I had it done. I had the multifocals, which I'm a layman, but what it means to the common person is that I do not need any correction for distance or up close. I have no glasses, period, for reading or distance, which means I can go upstairs and read without turning the TV on, and no glasses required. It's a little bit strange after so many years of fumbling around. And you can see my vision decaying, going downhill, and you did too. And now all at once, it's just like 50 years ago, not like 25 years ago. 25 years ago, I was still wearing glasses. But I mean, like 50 years ago, when I was 28, I didn't have any glasses. And it's just like going back then. But it's something you don't seem to appreciate. You just...
When I first examined Lloyd and found out he had cataracts, I was reluctant to do anything surgical-wise because his vision wasn't that bad. I mean, he was measuring what we call 20/30 on the eye chart, but he was saying, "Doctor, I can't see, I'm having problems with glare and problems with blurring, and it's not as sharp as it used to be." Now, Lloyd's a pilot. He's had acute vision all of his life and able to see a speck on a window from far away.
Different airplane.
From a different airplane, that's right. And so I was reluctant to even do surgery because I knew he was going to be such a critical observer. But he pestered me for over a year.
And you wouldn't do it. And you used a term, I thought that only applied to fruit or apples. You said I was not ripe yet. That's a terrible term, but anyway, I did lay on you pretty hard, and you wouldn't do it. 3 years it took.
So finally, I gave in and said, okay, I can see these are really bothering you, and let's try these new lenses. I know that you are a person who doesn't want glasses. You didn't want to be dependent on extra glasses for distance and near, and I know the way you were fumbling away with your glasses in the cockpits, and so we went with the multifocal lenses. And I did so with great trepidation because I knew how precise you wanted this all to turn out, and I was sweating every step of the way too because you're such a critical observer.
Gee. All right, well, I had my surgery done right here at VCOM in Bangor. And I wasn't on a long waiting list because this is something we had talked about for a year prior. And I had a complete workup. Now, I'm not an ophthalmologist, but I know I was tested from just thoroughly from one end spectrum to the other. I was in the OR, I don't know how long. It wasn't, they were both identical experiences, but there was no pain. I'm laying down, they covered my eye. I knew all the people, Gail from Presque Isle and everybody. And it was just a painless process. So, is that it? That's it. You're good to go. Oh, he told me when the cataract was, he said, I'm removing it right now. He told me when he was inserting the implant, and then I'm bandaged up, and away I go. And the next morning, I'm back in here at whatever time, 9:30 or so. And I believe I saw Dr. Bowman that particular morning. And he said, well, how you doing? Good. So I knew this was a moment of truth because I can't say anything because I got a patch on. And there's a reading chart with the numbers and letters down the hall. And he took it off. And I blinked a couple of times. He said, now how far down on this chart can you read? I said, I can read the bottom one. And that impressed him a little, and I did. I read the bottom one right off. I said, I can't believe this. Because before I couldn't even see the chart, let alone the letters. So and the second one was exactly the same experience. Except I'd already had the workup and everything, so it was a little, quicker that way. Let's put it this way. If there was a candidate here for multifocals, and he had questions in his or her own mind about whether or not they would work, I'd love to talk to him, and I'd just tell him my story. They probably, don't work out as well for everyone, but in my case they did, and I'd answer or share anything I could with him about it.